Hello and welcome to another episode of Katrina Speaks. I'm so excited. I've got two amazing guests on today. That's two. It's my first podcast with two guests on. Hopefully nothing will go wrong. And hopefully I can keep my mouth shut for long enough to allow other people to speak. Not making any promises, but I'm fingers crossed I can control this today. But I am super excited to have them on. We're going to be talking workforce today. We're going to be talking international recruits. And I want to touch on some of the policy changes that the government have been implementing within the sector and how that is impacting the frontline as well as business owners. So what better two people to have on with me? I have got the amazing Carolina from the Care Workers Charity. She is the CEO and she is all about making sure the care workers' voice is heard. So I'm really happy that she's agreed to be here with me today. I also have my wonderful local MP, Stephen Darling. He is a Lib Dem MP. He, again, is an advocate of the NHS and the social care sector. And I just thought it'd be wonderful to bring them both on today so we can have some of those real conversations. So thank you very much for both being here with me today. And if you would like to go on and introduce yourself.
Morning everybody, I'm Carolina Gerlich, CEO at the Care Workers Charity, a former care worker myself. And at the Care Workers Charity, we serve three missions. Mission number one is to support care workers financially through our benevolent fund. Number two, support care workers' well-being and mental health. And care workers can self-refer for therapy and mental health first aider training as well, that we deliver through a third party. And lastly, but most importantly, campaigning and lobbying around issues that are important to care workers, which includes registration, professionalization, pay, recognition from the wider society. We're here and I am here as the voice for care workers.
Brilliant. Thank you so much. And Steve, would you like to just introduce yourself?
Yeah, lovely. So I'm Steve Darling, Member of Parliament. I'm Member of Parliament for Torbay. I'm also the Liberal Democrat spokesman for the Department of Work and Pensions. That gives me an interest in this area to a certain extent. But also my background is I have been and am a councillor on Torbay Unitary Authority. I've been a chair of a social care committee many moons ago. Equally, it's one of the most important areas of a local authority is adult social care. And so I'm greatly steeped in this area. For the 18 years I worked for the previous MP of Torbay, social care was often a hot topic that came up in that area. And that continues to be in the 18 months that I've been the Member of Parliament for Torbay. So I'm keen to have a good conversation around this area.
Brilliant. And I'm so pleased to have you both here today. So I think I'm going to just go straight in. Steve, in the last 18 months, what would you say has changed in the social care world for you?
Well, in politics terms, that I would say there's two areas of grave concern for me. One is the way the new Labour government have come in, initially talking about positive change, doing the right thing for the NHS, maybe not as fast as we would like to see the change that we know that is desperately needed across the country, but going in the right direction. But what concerns me is is undertaking the commission and taking too long a time, because you can't do the NHS and social care in separate bits and pots. What you need to do them jointly, and we need to make sure that you are sorting them both out, because they are both complementary. They're both part of the same puzzle. So that's one area that concerns me, is that they haven't taken it both together. Happy to expand on that later. The other one is the uncertainty. When I've gone out and visited care homes, and the most important thing for me is not only to speak to the managers, but to speak to frontline staff. And it's staff who are coming from all over the world to support some of our most vulnerable and elderly people. They have this massive uncertainty now. and also the significant cost for the care homes of extending contracts of work in the UK is really disturbing. We know that they are already on really tight margins, care homes and domiciliary care, and yet it's making it tougher. And that uncertainty for work visas for some of the most compassionate people in our care system is shameful.
Yeah, absolutely. And I couldn't have said that any better myself, Steve. Carolyn, what are the care workers saying? I know you support a lot of care workers. What are you hearing?
There's the uncertainty around the new immigration rules, uncertainty and disappointment, I would say. Care workers are disappointed that the importance of the work that they do isn't really recognized, isn't realized by people in charge. If anything, care workers that speak to us feel that if anybody should be on a fast track for a visa or for a citizenship, it should be the social care workforce, as they support lives of other people. And what job could be more important than that, rather than bringing punitive measures? It seems of extending the time limits to 15 years and just for social care workforce, as if they were the least important and the job of supporting lives of other people really didn't matter. So there is the disappointment of moving the goalposts around these things because people would have arrived here with a certain expectation. This is what I do, this is how I behave, and this is how long I wait. And this is what I should be entitled to. So moving the goalpost for people while they're in the middle of the process seems incredibly unfair, and care workers are very worried about it. Aside from the immigration policy, care workers are watching and looking forward to see what comes out from the fair pay agreement. They are frustrated by the timeframes on that because, as we know, nothing has happened yet. Even the negotiating body hasn't been established yet. So care workers want to see what happens there. And while we're waiting for that, Aldi is announcing, oh, we're adding another pound, so 50 pence to our pay, and our pay is now sitting at just under 14 pounds per hour, whilst care workers are still just above minimum wage, uh, and 25% of the workforce is at the wage floor. So that's another thing that care workers are talking about. And then some of the ones we've had conversations with, especially in our advisory board and Champions Project, where we have 39 care workers working with us, is the Casey Commission. It's the frustration with the Casey Commission of how slow things are going, that it seems quite difficult to be in touch, and what are going to be the outcomes, and is anybody actually going to listen in the first place to whatever the report may come out from the commission, but also why is it taking so long to get anything out in front of the government on that? So I think the main thing is frustration with incredibly slow timelines and kicking decisions down the road rather than actually making very strong decisions right now to support the workforce that we really need.
Yeah, and I think, Steve, from you, have you got any sort of insight on the Casey Commission, how that's going? I mean, I've been quite vocal about the fact that the Casey Commission was supposed to allow frontline staff, providers to have the opportunity to engage. And unfortunately, what we've seen a lot happen across the UK is they've arranged those meetings directly with the councils. And then the councils have not made providers aware that those meetings are taking place and sort of cherry picked who they wanted to attend those meetings, which absolutely isn't helpful at all, especially when you've got larger providers, your SMEs, teams
Yes.
of 5,
Yeah.
etc. But I'm interested from your point of view. Do you have any sort of update or insight on that? We are hearing
Well,
constantly that
the thing, the,
though.
the the issue that I've been concerned about for Torbay, which at the end of the day, as a local MP, um, for the Bay, where we've got an integrated care organisation, which is that merger between social care and the NHS. That the government say this is the promised land that we want to achieve, and yet we know that there are some challenges with that, with the NHS over medicalising some of the care that happens, or a good chunk of the care that then puts additional cost on it. my key priority as the local MP, where that is a bit of a challenge in Torbay at the moment because the NHS are talking about walking away from it, was making sure that that got on the table for the KC Commission, which, and after a couple of attempts they have, and they've engaged, and our Director for Adult Social Care has unpicked her world. But as far as that engaging at that grassroots level, because it's actually only by speaking to people at that grassroots level you'd get the culture and challenges, and culture of organizations is really what it's all about. And it is, it's perhaps challenges that we could put on, but the crucial thing is we don't want it to drag on too much longer. We want it to come up with some conclusions and get out there, because sorting out social care is part of sorting out our NHS, and it is complementary by sorting both out hand in glove.
Absolutely. And I think the frightening thing is, it's out there, it's in the open, that doesn't matter what comes out from this Casey Commission, there isn't a ring fence funding to support it. And is that still what we're hearing, Steve? Is that still the message?
That is, I think, with the pressures that we've seen with the Labour government over the last 18 months, I don't think there is any light at the end of the tunnel as far as that's concerned. It's disappointing that it doesn't feel as if there is a long-term strategic thoughts going on. To be fair, the Chancellor now has more headroom after the last budget within her finances. So one would hope that if the Casey Commission did come up with a more positive way forward, but they needed a bag of cash, that cash is more likely to be there. However, we're in that where I've just come back from Ukraine the last few days for the 4th anniversary of that. And to a certain extent, there are other, as always with governments, there are other competing issues, including spending more money on defence to be off the Russians. So there are competing challenges, but we know that by investing in social care, you will actually generate savings, and particularly if you're doing that preventative stuff. So I'm hoping that the Casey Commission will see that, but also be alive to that over medicalisation issue, because it isn't just an issue for social care, it's also an issue for the NHS, where there can be, I know from when I've been involved in children's services and getting them in a much better place, by being too risk averse and over medicalising people, you end up in not the situation that people would want to be. People have less options in their lives, but also over medicalising does cost the NHS oodles more money than they necessarily need to spend.
Today's episode was proudly sponsored by Astrot. Now, Astrot does some absolutely incredible work around cybersecurity, secure emails, IT setups, all the stuff as a provider I don't even want to think about. It is so boring, and the fact that they enjoy doing this as a job, I will never understand. So what Astrot does is they make something that I do not want to pay for affordable. And then they also deliver it in a way that makes sure I'm meeting standards, exceeding standards, and not walking into a children's home full of children accessing things they shouldn't do. So they give me peace of mind. I'm able to sleep at night. I'm able to maintain my quality and my governance to ensure I protect my contracts, and most of all, I protect the people that I look after. So thanks Astrot for doing a job that not many people would want to do, and it is absolutely a well-needed public service. If you want to find out about this affordable, boring but necessary stuff, go to astrot.co.uk to enjoy your sleep. And I think for me, and I know Carolyn, you mentioned this a minute ago, so we've got the Casey Commission, we've got the Fair Pay Agreement, but we've got no money for anything. So again, in my head, the alarm bells are ringing. What would be prioritised, Casey Commission or Fair Pay Agreement? If we've got no money and then one bag of money does arrive, what would be prioritised? Because your Fair Pay Agreement, is appealing for the frontline as well. But then us as providers, because everyone knows I'm a provider as well, we're looking at, I'm starting to get council data coming in now. So we've got councils that are doing 0% uplift yet again. We've got tenders going out at £19.50 an hour on a 5-year contract, and on that contract, within those 5 years, the hourly rate will not change in line with inflation. And people are applying for these tenders, by the way, because people are just so desperate to try and get some work. But it's frightening, and we've got the employment rights bills, starting now, sick pay from day one in April, and at the moment we're not receiving funds to match inflation and all these changes. I mean, why have they done so much at once? The international recruits, employment rights bill, fair pay agreement. All of this is just literally sitting on our shoulders, and we're having no financial support whatsoever. I mean, Carolyn, do you think the actual front line understand the pressures that the providers are under as well? Because me as a care worker, I would be like, well, that's their problem. I just want more money. Do you think they actually articulate the mountings we're climbing at the moment just to keep afloat, and that actually the sector is under attack?
I don't think many co-workers do understand, and I think that's down to relationships within organizations. I think, unfortunately, too many co-workers talk to us about the difficulty speaking to the management about themselves. It's always focused on the people they support, and too many co-workers feel like they're being treated as tools that deliver care rather than individuals with their own needs. So I think organizational culture is a big part of it. I think misunderstanding of some policy. So last year, when the national insurance increase came out, and we signed a letter opposing it, we got some care workers contacting us saying, "Oh, why aren't you on our side? You're on the side of care providers," because that's how the sector's been pitted against each other, mainly by the government. I would say, with some of the policies, it ends up being us versus them. It's care providers versus care workers versus people who draw on care. We're on the same boat, and we all should be together. And it was quite hard to explain to co-workers that actually the national insurance increase, it's not money in their own pockets. It's not going to support them. If anything, many care providers are going to have to drop from the living wage as per the Living Wage Foundation to the minimum wage, because they're not going to be able to afford it. So I think part of it is lack of understanding of some policies, communication, and we're trying to work on that in informing care workers. Part of it is organizational culture. And I think part of it is that care workers in general, and the immigration policy contributes to that, and some other policies, don't feel respected and don't feel. I think there is an assumption that we're going to be treated badly if people have a choice. And we have an issue of care providers in the sector that really treat their employees very badly. We have some great providers in the sector that are very, very good. So I think maybe within those there's a better understanding. But I think generally speaking, a situation has been created when it's us versus them, between all the major actors in this situation. And it's very hard to help people understand that actually only by coming together between the different stakeholders, between the different associations, and everybody else, can we actually hopefully convince the government to change the attitude, and not just the government, the society, because the government doesn't care about social care because the society doesn't care about social care and doesn't vote on social care. Can't really necessarily blame politicians for not caring if the voters don't care. And every time I hear that MPs, I don't know, Steve, you have data on that from your office, but getting more letters about potholes than they do about social care, that is a problem. So I think we need to get better understanding within the society about the importance of social care.
Yeah, and I think Keir Starmer, the Labour government, are constantly saying we're putting more money in people's pockets. We're not seeing that. Our workforce are not seeing that. Providers had to make difficult decisions last year when things rose so substantially that a lot of the workforce didn't get a pay rise at all. Steve, do you actually think that this Labour government understands the impact that they're having on our sector? And do you think they actually care? Do you think they value our workforce at all? Because it doesn't feel like it's a priority for the Labour government at all.
Sadly, we had hoped that with a change in government 18 months ago, that things would, that the adults were now back in the room, because it was chaotic previously with Liz Truss and Boris Johnson, etc. I think we all hoped that the new Labour government would be in a much better place, but it has been sadly an omni-shambles. I'm sure that, as with most organisations, there are individuals within there who get it, but do they really get the bigger picture? And I think it also needs to be seen in a world where the country has high levels of debt, and there is just COVID, etc., has cost us a bomb, but there's still choices to be made here. And as Liberal Democrats, we fought the last general election. One of our key points was the NHS. To be fair, the Labour Party saw the NHS as a key priority, but as said earlier on, it is, it's all part of the same system, is the reality. If you're failing to sort out social care, then you're failing to sort out the long-term NHS, because then you're able to get more discharges from our hospital. We know that there are our hospitals, which are one of the biggest costly assets of our NHS, are jam-packed with people who have complex needs, who potentially could be cared for at home or in much less costly residential care offers, and it's getting them out of those systems. So it's changing the NHS from trying to fix things that are broken to the NHS that is a more preventative NHS. And that's where we need to be, and that's where social care needs to come in, and it is that keeping people at home and supporting them. So I'm trying to be fair to the government. They're in a tight spot, but then it's choices that you make, and the choice that they chose to kick the can of social care down the road is a very foolish one. And it's for us to keep on championing the positive impact that adult social care does, so they wake up and realise that it is more of an opportunity than a threat to them of sorting out, both people's lives, because that's what it's all about, is actually empowering people, letting people live their best lives rather than suffering, but also sorting out social care will help sort out the nation's finances.
Yeah, and I always say this, we're not a luxury. We are a necessity. We are needed. And Steve, I know, because you are my local MP, how amazing you are at going and meeting the public. You're everywhere. I don't even know how you sleep, and people say that to me all the time. But Steve is literally everywhere. And I mean, not just in social care, Steve, but when you're out and about, do you feel that the public are having more money put into their pockets at the moment? Is that the sense of feeling you're getting?
I don't think they feel that at the moment. And to be honest, I think that they would need a period of time to feel to actually see a change. And with uncertainty internationally that we're having at the moment, again with the orange man in the Oval Office, it's just more chaos. And whether it's business or whether it is people's own finances, we all like stability, and it does feel as if our world in the last, 18 months is just more and more unstable, and that uncertainty breeds fear. And whether it is, and when I go and speak to businesses in Torbay, they talk about like a bunker mentality, and they're failing to invest because they fear what is just over the horizon. And while some businesses, a good chunk of businesses are just about surviving, but there are some with some spare cash, but they're keeping it in the back pocket just in case things go wrong. Whereas if they had greater confidence, they'd be investing, and that's what drives our economy.
Absolutely. And Carolyn, I think, with the Care Workers charity, people can come to you and they can get support if they're in tricky situations. From your charity's perspective, have you seen a rise in people making claims?
So that we can't actually say that, because we operate on the basis we only accept as many grants application as we have money in the pot. Because what I don't believe in is giving people false hope, or then making judgments on people in similar situations of who is more worthy a grant and who isn't. We are not gods at the co-workers charity, and we should not be on our high horse making those determinations about people's lives. So the way our grants applications operate is every month we have a pot of money that depends on the funding we've got available, time of the year, etc. And then once people have applied to take away that pot of money, we close for applications. What I can say is that we have months that pot goes within 15 minutes. So we're not open for 3, 4, 5 days. We're open for 10, 15 minutes, because people sit there waiting for the 10 a.m. Like today, I'm sure there was a rush because we reopened for March. And sometimes 10, 15 minutes, the pot is gone. So that's rather terrifying, how much help there is. And we've supported over 13,000 care workers in the last few years. Um, and I'm sure more needs support. And if we had more funding, we would support more care workers. Majority of reasons why people apply is very much cost of living crisis related. People are having to pay for basics on credit cards, then they're in large credit card debt. They can't afford to fix their car, so they can't go back to work in the community. So then they lose income, and that becomes a vicious circle. They can't pay for MUT, or they go off sick and they don't have full sick leave pay available to them, which again is a big issue. And we definitely saw a lot of that as an issue for co-workers during COVID, where, with symptoms, you're supposed to stay home for 2 weeks. Losing 2 weeks of pay for somebody on low income has catastrophic consequences. So the need is definitely there. The workforce is struggling financially. People are not asking for nice to have. People are asking for desperate things and covering their basic needs.
That's really, really frightening. And I know, Steve, I'm not sure if you've ever heard about the work that the Care Workers charity does, but for me, that 15 minutes, I just can't believe that. That is harrowing. And I mean, as a good employer, we have staff that have situations and they have circumstances, and we always try to help where we can. But again, when we talk about providers keeping pots of money and looking at reserves and tightening their belt, unfortunately, in the last 12 months, that's the sort of tightening that we've had to do. All the nice stuff that we try to do, the going the extra mile, the bonuses. Don't even get started on the bonuses. The fact that now I can't bonus my staff more than £50 without it becoming a benefit in kind. We're being told to look after the workforce, and then we're being penalised and punished, and so are they, for anything that's over £50. And I just find the whole thing, it's confusing for me as a provider, let alone a care worker. But the way that would be interpreted to a carer is, I'm not worth more than 50 quid and I've worked for you for 10 years. It's this sort of mixed dialogue. What do you think, Carolyn, we could do to encourage carers to speak up more, to have that confidence to challenge? What do you think we could do as a sector? And I know we've personally been trying to do some work to bring the sector together, the front line. But what do you think we could do better? And how do you think we could encourage, like I said, Steve's very local, so and he's always advocating for our sector. But what could we do to encourage other providers to link up with their MPs to try and make sure we're capturing the frontline's voice as well?
I think it's relationships. It's relationships between you, Kat, as a care provider, and the people you employ and everybody else. Last year, we produced a co-production with Care Workers Guide, and it's about including your workforce in every decision you make in your setting, really. And that doesn't just go for care providers, that also goes for other stakeholders in the sector, suppliers to the sector, because care workers are the ones doing the job. And I used to be a care worker, and I know that no matter what the manager in the office thought was the right or the wrong thing to do, I was the one actually doing it. So my opinion should have mattered, and opinions of care workers should matter. So I think it's having those conversations first of all, and building relationships that we're in it together, not the us versus them narrative that's really being pushed down the line. I think we need to see what comes out from the commission, from FPA, because if it just becomes a piece of work, for example, the report from the Casey Commission, and nothing gets acted upon, like we've had thousands of reports in the past, papers of different colors, commissions, etc. Because I think if nothing happens and we as a sector don't push for some sort of an outcome from that, that's really going to make care workers feel like, oh, this is just performative art rather than actual trying to make a difference. And I think, Steve, people like you, different politicians, different MPs, actually speaking directly to care workers. But I wouldn't necessarily say going to care homes and having these nice conversations when everybody knows you're coming and everybody's going to say things maybe in a certain way, but maybe more unprompted conversations with care workers and inviting them to speak to you as well. We have run some programs with different local authorities in terms of a hardship fund that are geographically restricted. So that's another way that I think politicians, local authorities can help, because there is an issue with the funding for social care being separated between the central government and the local government. So we are happy to work with local governments. And Steve, I'll be very happy to have a conversation in terms of how we can do things more locally. But on a national level, it's talking about the importance of the work and importance of people that do that work, who shouldn't just exist to the extent of doing a job, but should have good lives themselves. Because how can we expect somebody who's hungry and who's worried about buying new shoes for their child for school to go to work and give their all every day? That's just an absolutely unfair and unrealistic expectation. But that's the expectation that is, there for care workers to live up to every day. And if they don't meet that, the hammer comes down very hard, and the media is all over it, only talking about the care workers that have done things wrong, forgetting about the 1.5 million that do their best every day.
Today's episode was proudly sponsored by Astra. They are incredible at what they do, and I am very grateful. So if you are a care provider that is purchasing a new service that has existing services, multiple locations, they can support you with full IT setups and integrations. They are also experts in managing all cyber security, full scope setup. They are experts in secure Wi-Fi, and as we all know, in the care sector, in children's services, it's absolutely vital that our systems are protected. We can track what staff are looking at, we can track what patients and clients are doing, and that nobody is at risk. And that is one security we all need in this sector. If you need any IT support whatsoever, go to astra.co.uk to learn more, and you will not be disappointed. Absolutely. And that is the key thing. We always have that negative dialogue going out into the media, and we need to change that. I just want to bring us back quickly to the international recruits and the immigration and the change in the policies, etc. Steve, what's the Lib Dems' thoughts at the moment around these changes and the impact? I mean, you're so involved with social care, the NHS.
Yeah.
And
we, as Liberal Democrats, we feel that they're completely wrong on a couple of levels. It's the additional cost for the businesses themselves, where there's the need to reapply, and that additional cost.
120%.
Also it's the impact on the individuals, and how do we make those people who are supporting some of the most vulnerable people in our society, how are we making them feel valued for the good work that they're doing? And we know there are shortages in this area of people coming and working, but it's also that how do we raise there needs to be adequate funding, which is part of the system and raising standards, but also it's driving that more positive culture and professionalizing it more, so that there should be an institution for social care, and driving that kind of like Royal College of Social Care type stuff going on, so that there is stronger acknowledgement and valuing the service of social care, because it is so important. So it isn't just seen as the people who pick up the pieces. It is such a quality of service that's important, and driving that culture change. But as far as that international recruitment, we desperately need these people, because we have difficulty recruiting within the United Kingdom, and so they recruiting them in an appropriate way, which is not putting barriers in the way, not putting barriers in them staying here, and equally not putting barriers in valuing them, and valuing them by potentially longer term stays here is really important. Because if you fail to value people, they'll vote with their feet as to where they go. We've seen this with junior doctors, where there is an ongoing dispute where, whilst the junior doctors may have been successful in getting an increase in their pay, which was substantive, but in the bigger picture, there's still America and Australia that are paying way more. And if you believe that what makes you feel valued is your wage packet, you will leave the UK and go and work elsewhere in the world. And that's my worry, is that particularly the brightest and the best people in the care system, those who they may walk and go elsewhere to work because they will be valued elsewhere more, are people who are the most vulnerable in society deserve the best.
Yeah, and I mean, that is happening now. They're leaving us. We've got people here in the UK recruiting, actively recruiting the workforce that we have spent the last couple of years, 10 years for some of these people, training, investing into, embedding our ethos. And now we have these recruiters coming in and offering them free transport, accommodation, better pays a rate, and, the opportunity to remain in their country because they're welcome. And that sort of dream was sold by us initially. We need you, come in, you're welcome. And now all of a sudden it's like, how do we get rid of you? If you've been here, you've served a purpose, you've paid your taxes, you've looked after the most vulnerable, but now we just don't want you anymore. It's appalling. I think, Steve, like, what is the Lib Dem vision? What do you see as the process and the system that works, that's sustainable and protects our communities? Because that's the key thing here. Because if we lose this international workforce, I would safely say you're looking at about 80% of the market having to close their doors, because we just don't have the
more professionalization of it, making sure that first of all, for the public's matters concerned, is going back to where we were when we were in partnership with the Labour in Scotland in 2002, so that social care becomes free at the point of delivery, rather than where we are at the moment in England and Wales, where you have to pay for it. So getting that's the basic starting point of where we are with social care. But equally, it's making sure that we get that basics right. So it's driving up standards. It's that more professionalizing, more valuing, because you're professionalizing it more. Having a college of social care, or Royal College of Social Care. But also, as the Lib Dems, we want to make sure that there's cross-party buy-in to this. So having something like a royal commission, so that it depoliticizes it, and there is more of a cross-party. This is what we do because we value our NHS. Social care is the other side of that coin, and that's why we want to make sure that there is a long-term vision. So having that Royal Commission engaged with that is really important for us. And then also, as far as the visas are concerned, making sure that we what Labour introduced, we effectively bin that, because it is such a blocker for people and making them feeling just so unvalued. And I know from my inbox is that I've had dozens and dozens of care workers saying, I've come here to support the most vulnerable in our community, and people deserve better than the way that we as a society are treating them at the moment, because they are, they're it's hardly as if they come here and claiming benefits. They're coming here and working hard, supporting the most vulnerable, but it's all part of that toxic narrative around people who are immigrants. And the reality is, when I spoke to somebody a few weeks ago from the city, the financial city of London, I said, what's the biggest things for you to grow our economy? He says the biggest things is tackling the cost of living crisis and making sure we've got enough people for our economy to thrive. So it's making sure that we've got a good, hard-working workforce, and that will include a level of immigration, because we do need to have more people here to be able to support the economy, and it's getting that balance right. So it isn't just that tabloid type approach of they're all here to play the system. The reality is that an awful lot of people who choose to come here have chosen to come here for a better life, and the way you achieve a better life is by working damn hard.
Absolutely. And, I've got international recruits and I adore them. I love my British workforce as well, but their ethos, the way they work, their attendance levels, they never claim a penny. They don't go off unless they really need to. That ethos is embedded into that team, and my clients adore them as well, and they are a big part of our family. Carolina, I want you just to quickly touch on, because I know we're running out of time, the Voices Across Care. If I said it right this time.
Yes.
So could you just explain to everybody the campaign, what we're trying to achieve, and what the goal is? Yeah,
so Voices Across Care is a campaign led by us at the Care Workers Charity and CAT Providers Unite to help care workers express their opinions and their views. We have a Facebook page called exactly that, Voices Across Care, where people can sign up, where we're sharing surveys, where we want to be sharing more information, more surveys, more up-to-date updates on the Casey Commission, for example, reports coming out, etc., to help the workforce feel informed and help the workforce share their views. So then we can take those views back to the policymakers, and so that those views are actually considered properly before making any decisions about the workforce that is larger than the NHS workforce, supports so many people across the country, and is based on relationships and humans supporting other human beings to live the best lives they can live.
it's amazing. And I think you guys, I don't know whether you're aware, Steve, yet, but Providers Unite has just announced that we're doing a national campaign, a lobbying campaign against the government to help educate the public on what we do as a service. I don't agree that we are a system, because systems are supposed to work well. And the campaign is launching next month. We've had a substantial donation from the National Care Association to allow us to do that first round of the campaign, and we have not as a sector ever lobbied against government like we're going to this year. So I'm quite excited, and I'm all ears, Steve, for any advice on how we can steer this campaign so we are here, so we are heard, so that we're successful. So any advice you can give, I'm all ears.
Really happy to. I'm sure we can pick up that after our time together now, but very happy
Brilliant.
to.
Brilliant. So I think just to wrap up, guys, I think I would just like to sort of ask you both to answer a final question. If we've got care workers that have listened to our sort of podcast today that are feeling exhausted or forgotten, what would you like them to hear from you as a professional? Steve, would you like to go first?
I think hearing the authentic voice of people at a grassroots level is really important. So I would encourage them to actually reach out to their elected representative. That would be really helpful, because I think, and it isn't, but also if they're caring for people, if that person they're supporting, get them to reach out and talk about how they're feeling valued by that individual, and how they are concerned about some of the challenges that they're facing. Because it is, you earlier on you spoke about how people are more bothered about potholes than social care, and to a certain extent that is part of the problem. When people step outside of their homes, it's the stuff that you can look, see and taste that bother you more than some things behind closed doors. So it is really good news about that campaign that's occurring, but it's also making sure that we're having those many more conversations around social care, and challenging people's in positions of responsibility is really important, so that it gets higher up the political agenda. And that's only done by lobbying and pressuring people, and doing that on a very grassroots level is really impactful as well.
Thank you, Steve. Come on, darling, give me your wisdom.
My wisdom. No, I think first of all, I want to say to all the co-workers is thank you for everything that you do, against all odds, on very low pay, with very little recognition, because this is where things stand at the moment. Thank you for just continuing to support people and making decisions to put other people before yourselves, and actually carrying on. Secondly, I'd like to say that the co-workers charity is here to help, and to join voices across care to help us actually drive change, to help us gather your opinions and what's important to you, and take it to politicians to influence them.
Thank you so much both for your honest and thoughtful conversations. I think for me, it's been really insightful to hear the views of both of you. And you know, one thing that really resonated with me is that we're not short of compassion in the sector, nor are we short of willingness to do better. And what I struggle with is how the government doesn't understand the value of our sector. And the one message I could give to anybody really is the only way we are going to get the government to start even considering putting the care sector at the top 3 of their agenda is by coming together, educating the public and unifying, so we have one voice. That is so key to us achieving nothing but positive outcomes for the people that rely on the services that we offer. So again, thank you so much for joining me. Thank you for watching. Please like, share this video, and there will be some more coming soon. And I also want to say a massive thank you to Astrop for sponsoring this podcast. Without them, I wouldn't be able to have these amazing guests come on and deliver these episodes for you. So if you are looking for a company that can come out and secure your IT systems, offer you staff training so that you are confident that your company is protected, they do so much more than that as well. Please contact them.